Oh, it is 12 o'clock noon. And good afternoon, and welcome to another installment of our ongoing nonprofit leadership and engagement series. I am Joanne Nazer, manager of nonprofit leadership and engagement at the Washington County Community Foundation. And thank you for joining us today to learn from our content experts on crafting a winning grant proposal 3. If you would like to ask any questions, please feel free to put them in the chat. And it is my pleasure to introduce Alicia Andrews. She's a senior program officer at the Eden Hall Foundation.
Thank you so much, Joanne, and great to be with you all today. Really excited to engage in some dialogue around funding. I want to start off by saying thank you to all of you on this Zoom for the incredible work that you do each and every day. Before I share my screen and kind of dive into a little bit about Eden Hall Foundation and also some elements of what we see as successful grant applications, wanted to just give you a little bit of my background. By trade, I am a social worker, trained at the University of Pittsburgh School of Social Work, bachelor's level and master's level, as well as the Graduate School of Public and International Affairs. And I spent the first 10 years of my career working at a one-stop shop community center. So a lot of the way that I framed my presentation is through the frame of you can take the person out of the smaller nonprofit, but you can't take the small nonprofit out of the person. So I always come to the work with that lens and really sort of see myself as a bridge between your organization, the incredible work that you're doing and helping our foundation and also the greater sector understand your organization and the great work that you're doing and leverage those resources. So without any further ado, I'm gonna test my technical abilities right now by sharing my screen. And a full disclosure, you're going to hear from one of my colleagues, Bethany Hemingway, on this Zoom as well. Our names and our contact information are at the end of this presentation, and you can feel free to follow up with any of us. I'm happy to engage further. But let's talk about the elements of a successful grant application. But before I do that, just full disclosure, a little bit about the framing also for today. A mentor once told me, when you meet one foundation, you meet one foundation. And it is no truer words have ever been spoken. So just with a little bit of that context, priorities can differ. The way that a grant proposal comes in may differ. The world and needs are constantly evolving. And really a lot of foundations, funders are trying to really have this delicate mix of both proactive and responsive strategies at any given time. And let's be real, in this current moment, I think that's really an important point to remember. Nobody has a crystal ball. So at Eden Hall Foundation, our areas of giving are really in 3 kind of categorical areas. Vibrant communities, really that's a lot of our larger arts work, things that we've done with larger arts organizations over the years, small arts, civic engagement work. We have a second pillar called useful knowledge, and useful knowledge is wherever someone is learning, we can be supportive. So we've really broken that particular pillar down into different opportunities in kindergarten through 12th grade, higher ed, early childhood education, as well as workforce training, libraries, out of school time, anywhere you could be learning, where can we really be supportive? And then our third pillar is health and wellness, which is our traditional sort of health and human services areas, things like focusing on basic needs, physical health, behavioral health, supports and access, also with an emphasis on our federally supporting and shoring up our federally qualified health centers, and also some work that focuses specifically on women and girls. That's a little bit about Eden Hall Foundation. again, I can tell you lots about us, but like we have a website, pretty much everything, like our LOI process, everything is there. And I would instruct you to take a look at our website, utilize tools like GuideStar, Candid to sort of see types of grants that we've made in the past. I'm going to kind of shift my presentation now because I feel like also, again, it's my can't take me out of the small nonprofit. I'm always thinking with this lens. It's really important, and I think you all probably do an incredible job of this, knowing your organization and your programs, the what you do and the why you do it. On this particular slide, I have different things. They're not necessarily in a particular order, but I can say from Eden Hall Foundation's perspective, looking at a particular grant application, we're going to be looking at what data is driving your response to sort of address this community issue. What is it that you're proposing to do that is going to make some sort of change around that in that community issue? What will result? And how will people really be impacted? That's kind of our continuum and our through line. So some of these different pieces here are different activities that you might do and questions that you might be answering along the way around what it is your organization does and why you continue or why you're doing it. I also included a bunch of, I'm sure on this call, you're aware of a lot of these resources, but I am, for as long as some of these will be around, utilize the free resources that are at your disposal. So again, when trying to figure out what is a particular need in a community, I'm going to use sort of my framing as being, I started in youth work. So it was really around working with a certain demography of youth in certain neighborhoods. What is the sort of income data for that neighborhood? What is the population, the ages, how many people live there? What are the characteristics of family? Some of my favorites, really, the top part of this slide is kind of how I choose to keep informed, particular during times like these, choosing how I go about getting my information. But then the bottom box, the using existing data and research to really help me put together what is my response. Things like the US Census data, particularly American Fact Finder, American Community Survey. I know we're in Washington County, but if there is any information that can be leveraged, sometimes you go to Allegheny County Analytics and also the Commonwealth of Pennsylvania. I will follow up with some of these. There have been some really great interactive dashboards that have been added, particularly at sort of the Department of Health level, Pennsylvania Commission on Crime and Delinquency, where you can get some real-time data to sort of, again, help with your case for the need. Kids Count Data Center is one that I've used for eons. That's put together by the Annie E. Casey Foundation. And then also the Future Ready PA Index is the current Pennsylvania Department of Education database that sort of groups. You can look at things by school district, by intermediate unit, by county, different sort of, you can slice and dice some information. So again, when thinking about what we look for in a winning proposal, these are some of the questions, and they don't have to be in any particular order. But again, these are the types of things that we're looking for, the why of what you're doing. What is that existing community need? Because we get a lot of requests and it's admirable of great ideas. But if there's a mismatch between what the community needs, sort of that data piece, or if there's a lack of demand, it's something that we can't respond to as well. What is the service? How's it going to be delivered and by whom? Who wants the service? Is this something that's being demanded by the community that currently doesn't exist? When will services be offered? In what manner? I'm not going to read all of these, but these are important questions that a lot of times I'm thinking about. I was a programming person. So people would be like, did you have a development person? When I started at the organization I was at, I think we had a $300,000 budget. There was no development people. I ran the after school program. I wrote the grants for the after school program. And to be perfectly honest, that was actually a really beautiful thing because not only did then our grant applications, in essence, were also a programming plan, we're also an evaluation plan because they're all intertwined. And you can use a single document in that way. So if you're the single staffer writing, that's the way I look at this. It's sort of like that single roadmap. Um, I have a slide in here around smart logic, smart goals, theories of change. But sometimes I don't want anyone to get hung up on, is there a form? Does it have to look a certain way? Basically, we just have to see the through line of the data in the community says this is missing or this needs to be addressed. Here is the thing or things that we are doing that are designed in a certain way to address that. And you go into a level of detail that you're painting a picture with your words and not just to have for a program officer to have a really clear understanding of what's happening. And then as a result of these actions, here's what's happening in the community and how people at the end of the day, their lives change and benefit. So these are just some of the things that you might think about that you want to, again, have sort of have answers to as you're putting together an application. I always put a piece as well around evaluation. I remember some folks are like, we'll know if it worked at the end. No, no. You want to be thinking about your program design, whatever the initiative is, and sort of thinking with the end in mind. If what you are putting on paper is successful, what's going to be achieved? And being able to talk about that and really sort of hypothesize and measure along the way. Full disclosure, we recognize so much is out of our own individual control. So things are going to happen. Plan for things to happen. If the last 5 years didn't teach us about that sort of ability to be nimble or even to just have those hard conversations of like, hey, I know we set out on this path, but here's what we're seeing, and we need to have a conversation about potential pivot or slight change. Those are the types of conversations funders want to engage in with their grantees. It's that continuous quality improvement, open dialogue, trust that's being built along the way. So always be thinking about sort of what you're hoping to achieve and build it in at every phase of your application. I would also say a little bit of guidance. Leveraging multiple funding sources is something that is also attractive to funders. Full disclosure, you can look on our 990. I think Eden Hall Foundation's typical grant payout is around, I think like between 10 and $15 million annually. And that's a lot of money. In the grand scheme of sort of government budgets, it's very small. So we have to work with our partners, with our grantees, anyone who's applying. Again, back into you can't take the woman out of the small nonprofit sort of brain. If your organization has a really good idea, how do we expose you to other potential funding sources? Are there alternative funding mechanisms that might be of interest that investors might want to learn more about your project? And you can, I'm saying this, and this is recorded, use the same proposal that you have created for another funder. Don't feel like you have to be creating something new if it's for the same project. Reduce, reuse, recycle. There may be elements, again, you meet one foundation that have to be slightly repurposed, but use those same measures, use the same narrative so that you have that strong base. Because I guess I should close with this, it's very hard for a foundation to be a single source of funding for a project, just given our limitations. And thinking about sustainability in your grant proposals at the beginning as well. Yes, we recognize that some of the ways your project might be sustainable is truly going to another foundation at the end of the grant period. Let's just have those open conversations. If it's, hey, we want to start this innovative pilot project and we'd like to prove that it works and then ultimately potentially secure government funding through this mechanism, hey, okay, we'll work with you over the time period to help get you there. But really, just thinking through that piece around sustainability in your grant proposals from the outset and being very honest about it. I think philanthropy, we're getting there, having more honest conversation back about this topic. And so, like, I would say, too, just a couple quick things in sort of summary. Strategic planning, you can integrate sustainability into your project from the beginning, just thinking about, okay, if we're going to start here, where do we want to be in a year, 2 years from now, maybe 5 years from now? Having some clear metrics, and I call metrics interchangeable. It might be deliverables, because in the beginning, it might actually be trying to sort of level set and develop your base of what you're going to be measuring. And I think one of the most important things as well is in terms of, I have here reporting and transparency. Really, I should have named that one. It's about relationship building with your program, relationship building and healthy communication. Just regularly update your program officer on your progress, your sustainability, any opportunities that have emerged, any challenges that might have emerged along the way. And full disclosure, we're fully human. Sometimes we're slow to respond. I appreciate multiple nudges and sometimes need them. But if we can be your thought partner, I think one of the things too that philanthropy, at least at Eden Hall Foundation, we're trying to do is be more than just be something beyond a grant, which is potentially how do we leverage additional relationships for you? How do we set you up so that after our potential funding period ends, you're at the next natural spot on your journey as an organization, as a program, and we've been helpful in that. So then at the end there's my information and Bethany's information, and we'll be sure to share those slides with you. But happy to take any questions, or if we want to segue, I leave that to you, Joanne.
Thanks so much, Alicia. You gave us so much to think about and really practical information that we are approachable, we are human, and that we want to have dialogues. And so with that, I'm going to introduce Dana Scarpino, who's the Manager of Community Relations at UPMC Health Plan. Thanks for being with us, Dana.
Thanks, Joanne. It's a pleasure to be here. I'm really honored to be presenting again alongside Staunton Farm and my colleagues at Staunton Farm and Eden Hall Foundation. I do have a lot of information to get through, so I'm going to share my screen here. Hopefully I don't botch this. Okay, hopefully you all can see that. You good? Okay. So as Joanne mentioned, I am the Senior Community Relations Manager at UPMC Health Plan. I've been here for almost 13 years, working in marketing communications and community relations for that entire time. So I've been firsthand witness to the growth and development of UPMC as we've expanded our geographic reach, and most recently with our partnership and acquisition of UPMC Washington and UPMC Green. So we certainly are keeping an eye on the Washington County community. But our corporate giving strategy has had to kind of grow and be flexible along with those changes in order to meet population health and social determinant of health needs in different regions. So that's really where I'd like to start, because addressing these issues is a core part of UPMC's mission, and it's also the driver behind most of what we do in the community. So these statistics are from the Robert Wood Johnson Foundation, and they found that about 20% of a person's health comes from the level of clinical care that they receive, but up to about 50% of total health is affected by your built environment. So that's your physical environment, your social and economic factors that influence how you eat, where you work, where you go to school, the types of recreational activities that you are able to participate in, and so forth. And I'd say that probably most of your organizations are directly related to that 40% statistics under social and economic factors, because you're really the boots on the ground that are tackling these issues with the targeted programming and communities that we all collectively serve. And some of you may even be dabbling in the health behavior space with the 30% there. Maybe you have some tobacco cessation programs or drug and alcohol abuse rehab programs and such. So that's really why it's important for us at UPMC to get to know you. I know Alicia touched on the relationship building aspect, and that's very important to us as a corporate funder as well. We want to help you meet your needs and your mission because we know that's going to translate into better health outcomes for our own patients, our health plan members, and the community at large. So I want to highlight some of our giving priorities, and this is applicable across the UPMC system. The organizations and events that we fund have to fall into one of these buckets, and I think that they're fairly self-explanatory, but just keep in mind that what's listed underneath each of them are only examples. We do support a wider breadth of programs than what is just listed here. I also want to mention that UPMC and UPMC Health Plan are under a single umbrella. So it's all one unified giving strategy, one decision-making process for charitable giving. We do not have a foundation, so this is a little different than what Alicia and Bethany are going to talk to you about. We only do corporate giving. And I'm sure you've seen various UPMC business units that have been tagged on sponsorships, such as our sports medicine department, Magee Women's Hospital, health plan, et cetera. But the funding all comes from the same place and requests all go through the same process. So now I'm going to dive into the various ways in which we invest in the community, and I'll talk about how you can request support from us. So the first thing is event and program sponsorship. This is a huge chunk of our charitable giving. We receive more than 600 requests annually for sponsorships. That's a huge volume. It all funnels through Pittsburgh, our Pittsburgh office, and we have a small but mighty team that manage the intake process. But in order to be considered, you have to meet certain criteria. So your organization and program have to align with one or more of the giving priorities that were on the earlier slide there. You have to provide brand recognition in return for our support, which is pretty standard for any sponsorship these days. So logos, social media recognition, advertising, et cetera, whatever makes sense for you. You might want to also offer additional benefits, such as free tickets to the event, or a table of seating if it's like a luncheon or a dinner, a vendor display table during a networking time, speaking opportunities, things of that nature. I will say that our sales team and our community relations teams for our government lines of business really love to go to events. They like being the face in the community. So that's definitely something that we look at. And I will also say that if you have a collaborative relationship with UPMC or a history of giving from us, it certainly is not required in order to get a sponsorship, but it can sometimes help your cause if you're asking for continued support. And I've also listed a couple of examples of the events and programs that we support. A lot of that has to do with galas and fundraisers for nonprofit organizations, events that are public facing, runs, walks, health and wellness initiatives, and things like that. So how do you submit a sponsorship request? Well, we do not have an online intake form, unfortunately. We've explored that and have always decided that the personal touch is more important to us. So we ask that you submit an email with the information that is included on this slide. So you can either send it to me or my colleague who is listed here, and I'll make sure it gets to the right place. A lot of times we'll get requests that were passed along from UPMC doctors or executives who have personal friends or contacts with community organizations, and that's fine too. Just know that whether you send your request to Brooke Ward over at UPMC Washington, if you have a personal relationship with him, or if you have a friend that works in some other area of UPMC, it's all going to the same place. It doesn't necessarily mean that your request will be given any more or less weight. It's just the process that we have in place. And as I said, we do receive a large volume of requests, so that's a lot of information for us to sift through. And we suggest that you keep your proposal fairly brief, while still giving us the information that we need to make a decision. Just don't send us a general email that asks for our support without giving those sponsorship levels and dollar amounts that we can choose from and a list of marketing benefits, because we'll have to go back to you and ask for those. That's definitely a must-have. And after we receive your sponsorship request, it's going to go into our review process, which is multi-tiered. It goes through a sponsorship committee comprised of representatives from across our organization, including UPMC leadership. And they meet about every other week, so plan accordingly. There's going to be at least a 6 to 8 week review time. Sponsorship requests that are under $5,000 typically have a shorter turnaround time than those that are above 5,000. So just keep that in mind. Okay, so next we have our our neighborhood assistance program. This is a program of the Department of Community and Economic Development. We've been participating in it for more than 20 years. We're one of the largest corporate funders statewide, and it's a really fantastic initiative that's a win-win for both the business community and the nonprofit community. It's where a good chunk of our investment comes from, because we use it as a way to tackle those social determinants of health that I spoke about in the beginning. And I understand that Jonna Pro, who is the Southwestern Pennsylvania director of DCED, was a presenter on a previous iteration of this seminar. So hopefully she was able to give you all the nuts and bolts of how the program works. I'm not going to go into details about that, but you can take a look at the DCED website for their guidelines. I don't believe the most recent ones for the upcoming funding cycle have been released yet, but they should be posted fairly soon. I do want to call attention to the recent tax credit increase that was passed with the state budget last year. So the statewide tax credit cap has doubled to $72 million. It used to be 36, so that's huge. And the tax credit percentages for NAP have also increased. So now they range from 65% to 95%. What does this mean for you? I think it probably opens you up to a lot more businesses that are going to be willing to participate in this program as funders. So the great thing about NAP is you can have as many funders as you want for your application. So if for some reason UPMC is not able to support you, you've got a lot more businesses that you can approach. And you can have, as I mentioned, as many funders as you need for your application. And it's also really good for gap funding. So if you have a project that just needs a final push to get over the finish line, we really like to see that. And DCED likes that because I know at least Jonna, she likes those one and done projects. So sometimes those applications have a higher chance of being approved. So because such a large chunk of our charitable giving comes through NAP, we have carved out specific areas that we like to hone in on. And these focus areas do align with our overarching charitable giving priorities. But with NAP, we take it a little more of a deeper dive. So for the next funding cycle, which is the 2025-2026 funding cycle, which is expected to open in April, we are primarily looking at projects that address food security, workforce development, and affordable housing, but we are considering others as well. So don't be discouraged if you have a project that doesn't meet one of those top 3 criteria. And I do want to mention that we've supported several projects in Washington County over the years through this program. We are currently in a 6-year neighborhood partnership program with the Washington CDC and another with Mon Valley Alliance in Charleroi. And we've also supported several 1-year projects with the Washington County Food Bank. And just last year, the Washington City Mission, our funding helped to support the groundbreaking and construction of their new wing of their building. So that was really exciting for us. So for our NAP funding request process, it's a little more in-depth. What we ask for is a 1 to 2 page proposal about your project, including all of the items that are listed here. So you need to describe what your project is going to be, what the need is, who the target population is that you're going to be serving, any projected outcomes, and the category of NAP that you're applying for, because there are different tax credit levels for that. And we need some budget information from you. I also really like to meet with organizations, especially if I'm not familiar with you, if we haven't worked with you before. It's, again, all about forming that relationship and seeing if you're a good fit for our priorities. And in some cases, a site visit is also helpful for me because it brings perspective to the level of work that needs to be done, especially if it's a capital project. So another thing I wanted to mention is we do not support capital campaigns through our sponsorship process. All of our capital funding would go through NAP. So just keep that in mind as you're figuring out which level to apply for. The NAP decision-making process for us is very competitive because it's limited to our tax credit capacity in any given year and our budget. So even if you apply, if you submit a proposal, just know it's not a guarantee of funding, but we do try to support as many projects as possible within our means to do so. And the review process is multi-tiered and rigorous. So I just want to mention in terms of deadlines, we do have an internal proposal deadline coming up on Friday, March 14th. So that's only 2 weeks away. You'll need to act quickly if you're planning to submit a request. So I'd actually recommend that unless you already have an NAP in place or you've already been planning for one, maybe hold off on approaching us for funding for this funding cycle. And we can have a conversation over the next year and think about supporting for the next funding cycle, just due to the timing of everything. The nice thing about NAP is that there's always next year. And given the fact that they just increased the tax credit amounts, I'm keeping my fingers crossed that nothing is going to change with the program and it's not going to go anywhere in the near future. Another tax credit program that we participate in is the Educational Improvement Tax Credit and the Opportunity Scholarship Tax Credit. Again, I'm not going to go through the nuts and bolts of this program, but you can look for their guidelines on the DCED website. The biggest thing I want to make you aware with this is that you need to make sure that your organization is approved by DCED before you ask us to support. Please check the DCED website frequently just to make sure that your organization is correctly listed with the correct contact information. Otherwise, we might not be able to notify you of our support when the time comes. And we have to execute our payments by the end of the calendar year. So as you can see under important dates, DCED does not approve business funders until the fall. So you may be approved as an organization, but the businesses aren't approved until much later in the year. Then we look at the entire list of organizations that have been approved and anyone who has come to us separately, notifying us and giving us some information. And then we make our decisions in November and disperse our funding in December, much like with NAP. So it's a pretty quick turnaround time. And if your organization doesn't have the correct information listed, you run the risk of not getting funded. If you're a new applicant, you can apply to DCED at any time on a rolling basis. If you are renewing, you should have applied last fall for the renewal, and you probably should have received DCED's approval by now, but I'm not entirely sure. But that's kind of the overview of EITC. What do you need to submit to us for EITC? Not much. It's not like NAP. It doesn't go through the same level of review. Again, it's more of a notification of saying, hey, we're here. We have this program that aligns with EITC. We're an approved organization. Please consider funding us. And then, like I said, we will review our list. And it just kind of helps to narrow down amongst the hundreds of organizations to choose from. My colleague Katie handles this program for UPMC, but since you're all located in Washington County and I'm based in Pittsburgh and she's based in Erie, it probably makes sense for you to approach me first. And I can answer any questions that you may have and also get you connected to Katie if there's anything else that you need to know. The final thing I just want to mention is we do offer support outside of monetary donations on a case-by-case basis. And it does depend on our budget and availability of resources, but if you have a need, just let us know. Probably the easiest thing for us to do is to provide community representatives for tabling opportunities at events. As I mentioned before, we have community representatives for our government lines of business. So that's Medicaid, Medicare, Community Health Choices and our CHIP program, they are always interested in being out and about in the community and having tables. They're really professional, very knowledgeable about health insurance, and they're able to answer questions from your constituents and even get people signed up for health insurance. We also have representatives from other areas of UPMC, our Pathways to Work program, community care, behavioral health, McGee Women's Hospital, and other areas. So keep that in mind as you're hosting events that have tabling opportunities. And again, on a case-by-case basis, if we have availability of some swag that maybe we can provide for your event, we can do that. Sometimes we're able to provide basic health screenings in our mobile van unit if it's available. And we also have some general health and wellness educational printed materials that we can provide as needed. So here's my contact information just to wrap up. Please feel free to drop me a line if you have any questions or if you need guidance on anything that I've covered today. I am happy to support you in any way I can or point you in the right direction. And I look forward to meeting some of you at some point. And with that, I just want to say thank you again for attending today, and I'll turn it back to Joanne.
Dana, thanks so much for your presentation. I'm sure we all learned a lot about UPMC and just its variety of opportunities that an organization can reach out and talk with you about. So thanks so much. So now I am honored to introduce Bethany Hemingway, Senior Program Officer at Staunton Farm Foundation, and to probably introduce us to the new Executive Director of the foundation. Thanks so much for being with us today.
Thanks for having us, Joanne. So everyone, I am Beth Hemingway. I'm the Senior Program Officer here at the Staunton Farm Foundation. But it's my pleasure because today we have, not today, but 2 months ago, our new Executive Director started, Monique Jackson. She comes to us from Family Links, but I want Monique to have the opportunity to introduce herself and tell you a little bit about herself. And then I'll jump into my short presentation because Alicia did a lot of it for me. Thanks, Alicia.
Hello, it's a pleasure to be here today. I will hopefully get to meet all of our community partners in the near future. As Bethany said, I joined Staunton Farm Foundation in December, and I have over 20 years of experience in operations of mental health nonprofit organizations, which I am hoping to bring some of the information I learned over the years to our grantee partners in upcoming months. So I will keep it brief, and hopefully we'll have an opportunity to meet individually with each organization.
Thank you, Monique. So as Monique alluded to, the Staunton Farm Foundation, we have been around since 1937. We serve 10 counties, just as Eden Hall does as well. And Washington County is one of our footprint counties. We fund basically in the mental health and substance use fields. What does that mean? We're working on that and redefining what that means for us as an organization. But for this topic of crafting a grant proposal is near and dear to my heart because I used to teach at CCAC and would teach at grad schools about grant writing. And grant writing is an art. So my first thing I would like to say is why are you writing this grant? What is the purpose of the grant? What data do you have to support the need? Who's asking for the program? Is it something that you thought was going to be a great program for the community and you just think it's going to be great, or do you have data supporting that information? You have a great data set that is available free to you through Washington County's 211. I'm going to put it into the chat for you right now to see. But when you look at this data set, I can already tell you there's unmet needs happening in your community, and how are you going to resolve these needs? So using the information at your hand, this is how you think about programming. This is how you develop programming. This is where you go to see what is happening in my community, what are the unmet needs, and how can we figure out how to solve those unmet needs. So using the information such as 211 through the United Way, this is a wonderful data set that I actually just found out about maybe a few months ago, but been playing with it a little bit more lately to understand community needs pertaining to particularly mental health and substance use. But again, there are many data sets alluded that Alicia pointed out to, but again, for winning a grant proposal, it's again, why are we doing this? What is the need? Is it really going to solve? Is it for 5 people in your community? Is it for 5,000 people in your community? These are the things that we want to know for population health, because if we're going to move the needle, we need to know how many people are being impacted. What is your solution? So I think of crafting a proposal of it's a solution to a problem in your community. And the biggest thing I also think in a winning proposal is about the sustainability. And I'm sure if Monique would like to talk about a little bit, and I don't want to put her on the spot because again, she's 2 months with us, but sustainability is a big thing. Again, we can go out and say, yeah, we're going to do this project. We have no idea how we're going to sustain it. We had talked to nobody in the community about the program. And we didn't even talk to Dana about our program at UPMC Health Plan, because this could be something that UPMC eventually could be paying for. Again, have you talked to the managed care organizations? When I say managed care organizations, I'm talking about the insurers of those programs. Have you talked to your county representative? I know when I talk about mental health, I would be telling you, have you talked to your Office of Behavioral Health? Have you talked to DHS? But again, I know there's a different people on this call. So have you talked to people in the housing departments? Have you talked to the people at the counties that work with you? So again, making sure that you have letters of support, that they also are supporting you and the program because they agree with you. There is a need in the community and they're supporting you to fill that gap and that need in the community. Have you talked to your community legislators? Again, your local legislating body might have the ability to move some of that money to your operations. So again, you could write a grant to a foundation, but it's not as simple as that. It's also about making the partnerships and making the connections for that program to live long after that we are here. So to be better for your community. But sometimes I will take that back and say sustainability, it could be a one-time type of program that it's for one type of need. So again, there's different ways it's just about need. So if anything from this conversation today is use the local data you have to craft your proposal. And also do a SWOT analysis. If you know what a SWOT analysis, figure out what the strengths of your community is. What are your weaknesses? Where are the opportunities? And what are the threats in this? So right now, we all know the threats is the potential cuts to Medicaid. If you're in that world working in the Medicaid population, that's a huge threat for a lot of, even in the philanthropic space. So again, whatever happens at the federal level is going to trickle down to our local communities. And we have to revamp and think about how we best serve with the limited dollars we have to support your programs. We do have limited dollars. Staunton Farm Foundation is small to medium in comparison to Eden Hall. Our annual giving is between, depending on how the stock market does, it could be $2.3 million to $3 million during that year, where Eden Hall, I don't want to say how much they give away because I don't know exactly, but I know they give a lot more than we do money away and at larger volumes. So again, know who you're applying to, because the Staunton Farm Foundation, we're about mental health and substance use disorder and funding around that. And you could look at our strategies on our website, which I will put on into the link as well. And you can look at our 990s. You can see what we've funded in the past. You can go onto our website and find that out. But I think it also would be having conversations with staff. Reach out to myself, reach out to Monique. We want to meet with you. We want to come out to Washington County. We don't want to be sitting here in downtown Pittsburgh. We'd rather be out in the community, learning about the needs, how we can best support those needs, making those connections to other organizations of like-minded organizations, or trying to help sustain that program that we know is going to be viable in that community. So I just said a lot of things without slides, because Alicia covered a really good portion about the objectives and using, if you're not familiar with logic models, become familiar with logic models, because logic models can be used for just simple program planning. They could be used for your own life. I mean, it might not sound fun, but logic models are a really good snapshot of planning your program. But while you're planning the beginning of your program, again, Alicia pointed to it at the beginning, always think about sustainability at the beginning, because at the end, I have been doing this for about 15 years and I've learned many lessons. But one of the lessons I've learned, and it just crushes me to think about, is that getting a position funded, somebody gets employed, that organization thought they had a concrete sustainability plan and there wasn't. The position was eliminated and the person was unemployed. My personal philosophy in going into this work is do no harm. I do not want to harm a community if we cannot support and and plus we're bringing mental health clinicians maybe into your community. We don't want to be parachuting mental health clinicians in your community and not finding a way to keep them in your community. So again, Sustainability is a huge piece into grant writing and figuring out and how do you collaborate with your community partners. Collaboration is key moving forward. And I'm going to leave it at that so there's time for Q&A.
You did a great job, Bethany, right on time here.
Thank you. That's why you saved me to the end.
That's true. That's true. So just want to thank again the presenters, and just a lot to think about, a lot to do your own research on for your organization, and how to start creating relationships. And, as all the presenters said, that we're approachable. You need to talk with us, and we can see, does this fit within our guidelines? Does this, in the right area, program area? And that you can find this out before a lot of time is invested maybe in the wrong direction. Not that it's not useful or not helpful, but it may not fit within the certain foundation criteria. So, does anyone have any questions? Do we have any questions in the chat as yet? Or does somebody want to put up their hand? I don't know if I could see. We have a lot of people on the call, so maybe it's best to put it in the chat. All right, well, I know this is a time of change, as we say, maybe confusing time, chaotic time can be said. We'll ask the presenters, is there anything specific that you want to say to the nonprofits out there who may be a little bit nervous right now? Can we start with UPMC?
Yeah, sure. And we were kind of talking about this before the meeting started, just amongst us, the presenters and Joanne. I think we, like everyone else, are just kind of working through the political ups and downs and the implications of this. So we're kind of taking a wait and see approach, because no one really knows what effect these changes are going to have on the community, on the healthcare system and such, with various cuts to Medicaid, various cuts to the community organizations. I know I've talked to several organizations already that have been impacted. But at UPMC, right now it's not changing anything for our giving. Our giving strategy is the same. We're just kind of doing business as usual and moving forward, and keeping an eye on things, making sure that our government relations team evaluates as the changes come through. And I don't know if my colleagues on the call have anything else to say about that, but right now there isn't anything to indicate that we would need to change our giving strategy at this point.
Thank you for that, Dana. And I think here at the foundation, and next month we're offering some community snapshot focus groups, and I'm sure we'll hear more from the organizations that have signed up for that, to hear their opportunities and challenges as well. Alicia?
I'd like to echo Dana. Something that I think just personally and professionally, I'm navigating is separating, fact from fiction, noise from legitimacy, and sort of seeing that that's actually, and recognizing that that's actually a tactic, right? Because when one sometimes feels overwhelmed, we freeze. So it's really sort of just, okay, what is fact? What is fiction? There's nothing that indicates at this point that anything has to change. If in fact it comes a time that something does need to change, I think there will be clear communications to all potential community partners. I have found solace in sort of following, like when you see the governor post like, hey, $2.1 billion is not in fact tied up and it is flowing. Okay. And that is from the governor. Good to know. So what I would say is, certainly we're trying to be both. I have an 11-year-old daughter and a 7-year-old son who are in like the midst of like sports like you wouldn't believe. How do we play appropriate defense and still be on offense? What's that mix? I think we're all trying to navigate together. And I think just from sort of the foundation's perspective, it's trying to be as responsible with the resources that we have so they can continue to support and anticipating that pivot. Not that I want to equate this to COVID or a global pandemic, but I will say like a silver linings kind of looking backwards, we were able to do that then. Hopefully we could continue to do that now if needed to.
I love the sports analogy. That is so appropriate. We do. And yes, I think it's when to be offensive and when to be defensive. And there was a question in the chat. Sorry about that. Maybe, and Monique, you'll have a second to do it. But I think we talking about more maybe capacity building grants or capacity building support for organizations. But there is always that ongoing operational need. Is there something that you would like to address in that category, Beth or Monique?
I was actually private chatting to Maria about this because, again, I understand the American Diabetes Association and the structure. I used to work for the American Liver Foundation. So I kind of could give you some ideas, and I'm giving her someone to talk to that would help her with this general operating question, and how to draw down and work with your nationals to get some more money out of them. So I'll connect you to that person. But again, every organization, again, is uniquely different because, again, the American Diabetes Association is differently funded than an organization that is a mental health organization that could be reimbursed from Medicare or commercial insurance. So again, when we're thinking like it's not one shoe fits all for your organization for funding, because again, there's some levers you can't pull into to get that reimbursable rates or get into Medicaid. So just thinking about how do you work with local partners and people who've been in your shoes before. So again, I might not do your work, but I know people who do the work that you do, and I'll connect you. But the question of going back about what's happening in the world, I think Alicia and Dana answered it perfectly. And I think like right now, and Monique's on the call too, so I just think we're just holding space to see what happens. But also I'm going to use like the Grateful Dead. Like I'm just going to keep on trucking until somebody tells me differently, or some order comes down and says, I can't do that anymore. So I'm just going to keep on doing the work that we do and just keep on serving the community that we know how to do. And until people tell us differently, I mean, that's what we should be doing. But being defensive and smart of what we're doing. So those are my last thoughts, because I have to talk to people like Alicia and Dana to make sure I'm still in reality.
I thought you were going to burst into song there. Any great, no, not yet. Okay, we'll have to wait a while. Is there any other questions that we need to cover right now? You have some experts here. Feel free to, they have a few more minutes to tap into their mindset.
Feel free to ask away. I wanted to tag something on too with just sort of the ask for ongoing operating. Absolutely. And we know that that's a need. Also just thinking about considering how your organization, your programming, what you do, how it can also be reframed. And different elements of it. So I always think of, I remember, you know, when folks present a certain funding stream as like an answer to all things, like know that that's not reality. So I always am thinking of my programmatic budgets as pizzas and slices of pizza. And sometimes you want the whole pie. Sometimes you want like a couple slices. You want to specialize. I'm seeing like your local camp for children with type 1 diabetes. There's opportunity there to also frame it as a sponsorship. Sometimes it might seem like there's opportunities to think about your work while it is an ongoing operating cost. It could be framed externally. And full disclosure, you can just keep sort of within your team, within your stakeholders, your board, having those conversations to think about. I think binary thinking, and binary thinking is the way that, okay, well, we can make sense if it's this or that. The realization that it can be this and this and this and this is where you unlock your innovation and your true, like the power and the opportunity in your work. So I'll just leave that there because Patty has a question for Dana.
Yes. I don't know if you can see that, Dana, but it's, can you apply for sponsorship and EITC funding, or do you have to choose one? Once you get UPMC funding, or is there a choice?
That is a great question. And the answer is you can apply for sponsorship, NAP, and EITC funding if you wanted to. However, just be aware that only one may be approved. I wouldn't recommend going for all three at the same time. And when it comes to the tax credit programs, EITC and NAP, also keep in mind that it all comes under the same tax credit capacity for our organization. So if you are getting funded by, if we decide to fund you through an NAP program, it tends to be a much higher dollar amount than EITC, but that means our tax credit capacity is being eaten up more by NAP, and we only have, X amount of dollars left for EITC. So the EITC dollars tend to be much lower dollar amounts. But it doesn't, one doesn't necessarily preclude the other. So I think it just matters what makes the most sense for your organization, and what maybe has the highest likelihood of getting approved in terms of the projects that you're going for in the populations that you serve. So that's where a conversation maybe would come in handy with me, and we can kind of figure that all out if you're considering more than one.
Great answer. Organizations have choice. So, and that is something that you think of, what is your highest priority maybe? And that is something the organization has to decide. Is it, making sure this event is well attended or fully funded, or some programming, which is, you have to share with us. That's what what we need to know. And that, but your organization needs to determine that. What do you vote the highest priority is? So Eden Hall and Bethany, they put in their information. Dana has her information there as well. So we're coming up onto the top of the hour. Any last comments or any other suggestions for our attendees?
Don't be scared. Email us, please. We like to hear from you.
Yeah. Yes, we're all humans here, as we have said. Feel free to reach out, and I've seen the heart emojis, and I see the thumbs up emojis. Come on, we can talk to each other. So I don't know how to do that, so we're good. We're good. So it's great to meet Monique and Beth, Alicia, and Dana. So we just thank you so much for participating in this. And the next session will be on April 1st. It's no joke. And it's on cybersecurity. So, and it's an important topic for all nonprofits. So thanks again for the outstanding presentations. I appreciate it very much. Just to let you know, the capacity building grant cycle is open until April 1st. The African American Community Fund is open till this Friday. And if you want to reach out and talk about any particular project, feel free. Thanks again, and hope you have a wonderful day.